Hello, my name is Ralf Friedrichs. I'm an addiction recovery coach and the host of the Take Your Life Back Today show. As an addiction recovery coach, I want to share something with you, and let me be crystal clear to leave an everlasting impact upon you. Just imagine being buried alive. You're in the coffin, but you know you're not dead. You don't know how to get out of that coffin. You tried lifting your lid, but the enormous weight upon the lid prevents you from opening the lid. You tried banging on the lid to hopefully unsettle the dirt. Maybe somebody might notice and start digging their way down towards you. This is what it's like to feel at the lowest point of alcohol and drug addiction. You know you need help. You know you can't do it on your own. You don't know where to turn. In reality, there are probably people standing by your grave. You just don't know that. You just think you're going to die. Usually, though, people don't think about death when they're habitually abusing drugs and alcohol. In order to feed an addiction, you have to be great at repressing the fear of death. I often ask you, that's right, you, my audience, did it ever cross your mind while you're abusing drugs and alcohol that you might overdose and take something that God had given you, called life? Now remember, that life was a loaner from God. Now if you're selfish enough to just take your life and not even care about it, what about taking your life away from the people that love and need you most? Mother, father, brother, sister, husband, and wife. With that, let me leave one last thought. Don't be like the person that I just spoke about that went to their grave and didn't get any help. Instead, pick up the phone or call me at 844-405-HELP, and I promise, together, you and I will help you take your life back today. Let's talk about overdose cases that spiked in Louisville. 52 overdose calls within 32 hours, my friends. Think about that. Think about what I just said. 52 calls within 32 hours. Most of all the calls were heroin overdoses, says an emergency service spokesman. No overdose deaths were reported, but one heroin user died in a car crash. This time, it happened in Louisville, Kentucky. Let me just straighten this out. Kentucky, where Louisville Metro Emergency Services responded to 52 overdose calls. Think about that. 52 overdose calls between midnight Wednesday and 8 a.m. on on Friday, said an agency spokesman. That was a big jump over over 25 overdose calls received the same 32-hour time frame the week before. A breakdown of overdose causes was not available, but Burtmeister said most of the calls were heroin overdoses. Heroin is just running away, taking lives from people that have a addictive personality. Paramedics also dealt with overdoses of alcohol, prescription medications, and other controlled substances. No overdose deaths were reported, but Burmeister said one person who had been using heroin died while riding in a car that crashed. The driver also was using heroin at the same time. Why opiate overdose deaths seem to happen in spurts? Such overdose clusters pop up in different spots, and authorities aren't sure why. It leaves the authorities very baffled. In Cayuga County, Ohio, which includes Cleveland, at least 14 people died of opiate overdoses over the weekend this month alone. This was as per CNN reporting. Already this year, folks, more than 60% of the autopsies conducted at the coroner's office in Montgomery County, Ohio, which includes Dayton, involved drug overdoses deaths. Nationwide, the spike in opiate overdoses is blamed on heroin and fentanyl, a pain reliever often given to cancer patients. Death rates from synthetic opiates, including fentanyl, increased 72.2% from 2014 to 2015. This is as per the CDC Control and Prevention Center. Louisville authorities say it's too early to tell if fentanyl-laced heroin caused the overdoses in their particular regions. Heroin is not a new problem in Louisville. Metro Emergency Services answered 695 overdose calls in January alone, an average of 22 a day. Louisville Mayor Greg Fisher talked about it during the State of the City address, February 2nd, saying the police department is hiring 150 more officers and adding 2 new squads of detectives to address crimes involving narcotics. We're collaborating with the DEA on overdose death investigations to get heroin dealers off our streets and forming a task force with other agencies including the FBI, DEA, ATF, and the U.S. Attorney, Kentucky State Police, and State Attorney General Office to pursue, arrest, and prosecute our most violent offenders that are out there. Dr. Robert Couch, Emergency Medical Director at Norton Outbound Hospital in Louisville, said many more overdoses are being treated at the hospital and the patients require a larger amount of naloxone. That is a medication sold under the brand name Narcan, used to treat opiate overdoses. A growing number of overdose patients must be admitted to the hospital rather than be treated and released, he said. The emergency room is also seeing more repeat patients, he said, because a lot of these patients, when they first, let's say, get arrested for drug possession, they are put in jail. They serve their 30 days and come out and start all over again, instead of being put into a facility to help conquer and defeat their disease. It is not a crime when somebody has a disease, is it? If you have cancer or diabetes, that's not a crime. Well, if you're an alcoholic or addicted to drug, it's a disease like cancer and diabetes. It needs to be treated. It cannot be just take that person, throw them in a cell for 30 days and release. It's not a catch and release program. Diseases have to be conquered with treatment, rehab, and recovery, and a after facility lifestyle. Let's all start today helping the people that are out there that desperately need our support with their disease. I'm one of those people that have a disease called alcoholism. Yes, I've now for years lived in recovery. I've succeeded in living as an alcoholic a sober life. And you can too. But what it takes is dedication. What it takes is for you to admit you have an issue. And what it takes is the proper authorities or proper channels out there to give it to you. For the folks watching me that don't have insurance, but want help so desperately, you can find it. All you need to do is give me a call at 844-405-HELP. I promise I'll help you find a, I'm going to sneeze, a facility or a program that's out there to meet your financial needs. No one, no one in this country should go unchecked when it comes to the terrible disease of drug addiction and alcoholism. Everyone deserves to get treated. For you doctors that might be watching me out there from some of the rehab centers that I personally have my videos playing in there, I beg you, I urge you to offer programs to people that have no money. As much as I do these videos and my show pro bono, not meaning I don't charge, why can't you, counselors, psychiatrists, and medical doctors out there, give to the needy, qualify the people first to make sure that they're not just utilizing the system. If you see that they don't own anything or have nothing, give them the treatment. Don't let them overdose. Don't let them become the statistics in Ohio of 72.2% increase in 1 year. Together, you and I can help fight this terrible disease. Call me at 844-405-HELP, and may God bless you.